everybody, my name's Stuart, I'm a sports therapist. Welcome to the first of my videos talking about aches and pains that you may have picked up through lockdown. I've seen quite a lot more people running and walking and cycling over the last few weeks, and I've had quite a few people ask me about knee problems and how to deal with them. So firstly, the knee is quite a complicated joint. There are several common problems that occur due to either over-exercise or incorrect exercise. But the most common that we see is runner's knee, which is patellofemoral pain syndrome. Usually you start to feel pain in the knee, sometimes behind the knee joint or behind the kneecap. It can come with redness as well and swelling. Occasionally it will feel hot to the touch, but often find that it's worse going up and down stairs or running up and down hills. Firstly, the most important thing is you need to rest. Take 2 or 3 days off exercise. Apply ice to the area so that we're helping to take away inflammation, and give it time to heal itself. Normally we would send you to a GP just to check that it's not something more complicated, like bursitis or something. But with the way things are at the moment, you may not get in to see a GP. That may be a lot more difficult. So we're looking at self-help exercises and things that you can do to try and alleviate the pain in the meantime. So normally this type of injury is caused from weak calf muscles or tight calf muscles and weak or tight quad muscles. So this is the areas that we need to work on. After about 3 days of rest and treating it with ice 2 or 3 times a day, as long as the pain has started to ease, we want to start on a few gentle leg stretches. So the first one, if I can get this right, is this chap here. So we're going to work on stretching the quad muscle. This is quite an important stretch. It helps to get those quad muscles nice and loose. One of the most important things is to keep that as supple as we can. It's a big muscle, 4 muscles actually. So we can do this standing up, but it's better laying down. If you've got problems with the knees, when you're laying down you take the pressure off the knee so you're not trying to balance at the same time. So we want to look at holding that stretch for about 20 seconds, and do it 3 times, and then switch over to the other leg. And that will help tremendously. Secondly, we want to work on a calf stretch, which you should be able to see. There we go. So pushing against the wall, one leg behind you, one leg in front, push forward. That helps to stretch out the calf. The other thing we can do is to drop the heel off the edge of the step, and that will also stretch the calf muscle out. So we need to keep that nice and stretched. Again, 2 or 3 times each side, and we want to be doing that in the morning and in the evening, and sort of throughout the day whenever we can, really. So we need to stretch as much as we can. After about a week or so, you should start to feel things are starting to get much better, and you should be able to walk quite happily without too much pain. There will still be some pain. It's not going to go away that quickly. But then we want to start to look at rehab exercises. So I've got a few here. I don't know if you can see those, but you can contact me and I can send you some information one-to-one if you need them. As you can see, we have the wall squats, which is leaning against the wall and performing squats. We also have the guy's got a cord tied around his ankle and we're pulling back. So that's a resistance stretch, resistance exercises, and obviously some stretches as well at the bottom there. If you need more information on that, just drop me a line and we can have a chat about it properly. We can go through things on a one-to-one basis. If the pain carries on, doesn't seem to be getting any better, then we're going to have to try and contact a GP at some point because it may be something worse and something a bit more serious. But hopefully these few pointers should give you something to do and help you to heal the problems short term. If you've got a problem and you need some more help, drop me a message and I'll try and help. Thank you.